Welcome. Good afternoon, everybody. My name is Michelle Schuman. I'm a physical therapist here at Prairie Rehab. I've been a physical therapist for 28 years and been here with Prairie Rehab for 8 or 9 years, somewhere in there. But I'm here this afternoon to talk to you a little bit about back pain. If you have any questions during the presentation, please feel free to put them in the comments box below, and we will answer them at the end of the presentation. So when somebody talks about having back pain, what do you think of mostly? Mostly you think of low back pain, okay? Well, what is our low back? Also known as our lumbar spine, okay? So I have our good and talented Mr. Spine here with us today. So I'm going to kind of turn him sideways. So this is the pelvis and this is the spine, okay? The bones of the spine are also known as vertebrae. Okay, so our lumbar spine is consistent of 5 lumbar vertebrae. If you count down here, it's L5, 4, 3, 2, 1. So those 5 vertebrae is what makes up our low back or our lumbar spine. Also in our lumbar spine are these things here, kind of shock absorbers. There are discs, okay? They're made of some fibrous tissue and a lot of water, actually, and they do just that. They create a shock absorbing between the bones. They also help protect the nerves from getting pinched between the bones. Also in your low back are ligaments, which connect bone to bone and give your low back stability. And then there's tendons that attach your muscle to the bone to allow for movement. And then, of course, the nerves. That's what all these little yellow things sticking out. So we have nerves on both sides that come out, and then your spinal cord actually goes right up. You can't see it. It's within the bone of the vertebrae, okay? It's protected by that bony vertebrae. So that's what makes up your low back. Up to 80% of the population will experience a back problem at some time in their life. Over 25% of adults, when asked at any given time, will report that they've had low back pain within the previous 3 months. Having low back pain is the single leading cause of disability or loss of work, and it's the second most frequent reason for people to go to the doctor. The presentation of low back pain can vary from a dull, gradual, constant pain that just kind of gradually comes on for no specific reason, to maybe a sharp, intense pain that might come on very quickly because of an injury, lifting something, moving just wrong, etc. So the descriptions of those pains, we can go just a step further. You might experience what they call acute low back pain, which means that it came on very quickly and very suddenly. That might be from lifting, carrying, twisting, and you all of a sudden have low back pain. Chronic low back pain, on the other hand, is pain that you've had for greater than 3 months without being resolved. About 20% of the people who are affected by acute low back pain unfortunately do become chronic, especially if they have the pain for greater than a year. Low back pain can be caused by several different things. There can be muscle strains, which is when a muscle is overextended in its use and it's kind of like a muscle pull. Even with a bad muscle strain, you might have some little tears in your muscle. Not a complete tear, but they call them often micro tears that just are an injury to the muscle in your back. You might also have a strain or sprain of the tendons or ligaments, which provide that stability or connect the muscle to the bone. Again, from just overuse or overstretching, the tendon or ligament can be injured. There's also things such as degenerative disc disease, which is where those discs that we talked about here, from wear and tear, they lose their integrity and might become thinner or more fibrous, and the degeneration is oftentimes age-related and can be somewhat genetic as well, okay? You might have a disc bulge or herniation, and on Mr. Spine here, that's kind of demonstrated right here. a bit of a disc bulge where there's been an injury where part of the disc kind of pushes out to one side, and it can cause some nerve irritation where that nerve comes out. A disc herniation is where that side of the disc might actually split open and some of the inside kind of bulge out and herniate. Both a disc bulge and disc herniation, people live with those things all the time. Some herniations do require surgical intervention, but not always. Other injuries might include fractures, which is actually a break in the bone, which would of course need doctor's intervention. In general, inflammation. So inflammation is swelling, okay? Swelling might present as redness, warmth in the area, actual visible swelling, and of course pain. And that inflammation can come on from many of the things I've already discussed. Irritation of the muscle, the tendon, the ligament, the disc, all of those things, one of the responses the body could give is that it becomes inflamed in that area or swollen in that area. Arthritis is another thing. With the joints, those bones coming together, the wear and tear on those bones and the changes that happen includes arthritis. One thing that a lot of people have heard of before is someone who has sciatica. So sciatica is when your sciatic nerve is irritated, and your sciatic nerve is composed of several of these nerves of the low back actually coming together and forming your sciatic nerve, and then it passes down through your buttock area all the way down your leg to your big toe. So anywhere that nerve goes can be irritated. Any of that nerve irritation can be inflamed and can present as pain anywhere along that nerve. Oftentimes with sciatica, you might have some low back pain, but then you might also have some radiating pain, numbness, or tingling into the leg on the side that's affected because of the irritation of the nerve. And lastly, I want to mention spinal stenosis. Spinal stenosis is a change in the vertebrae, in the joints that surround the spinal cord, making it irritated, making it less space for the spinal cord to be there, and then can cause an inflammatory process and irritation of the spinal cord itself. There are some risk factors to having low back pain. Number one of the things we can't control is our age. As we age, there's more wear and tear on our back, and more definitely we can incur some of the things that create pain in our low back. Our fitness level. If our muscles are weak, not only our back muscles, but abdominal muscles and hip muscles that help support our back, the weakness in those areas can cause an increase in pain. Weight gain. If you think about when you put on weight, it's extra strain and load for your low back and the muscles of your back. Genetics, another thing we cannot control. But genetically, sometimes people do have weak discs, weak muscles, etc., or more prone to arthritis or things like that can create back pain. Occupational duties can play a big part. If you have a job or an occupation that involves a lot of bending, lifting, twisting, those are all things that can create more wear and tear on your back and result in pain. So things that we'll talk about shortly here, posture and body mechanics, become very important when you have a job that requires those things. Again, posture, like I just mentioned, if you're constantly in awkward postures or don't pay attention to having good posture, it can create more strain on your back. And then if you're a smoker, it's been shown that smoking can reduce blood flow, which then reduces the nutrients that are necessary to keep those muscles, tendons, even the discs in your back healthy. And then if you do have an injury, as a smoker, healing tends to take longer. So how do you know or get a diagnosis of back pain? Well, often days my back hurts, that's back pain. So you can kind of self-diagnose, but really an official diagnosis needs to come from a physician. When you go to the doctor, they might do some x-rays. X-rays are going to show if you have a fracture or break in your bone, or if there's arthritic changes going on. In order to see things going on with the disc, ligaments, tendons, muscles, a CT scan or an MRI would be required. And those are the things that can diagnose if there's any damage or injury, or if there's just a lot of inflammation going on. Things you can do for yourself at home if you have low back pain. Number one, eliminate the activities that aggravate or increase your pain. If you do a lot of lifting, pay attention to your body mechanics. If you're sitting at your now home office and you're sitting for a couple hours at a time, and when you go to get up, your back really hurts, that's an indication that you need to get up and move around more often. So you want to eliminate activities that create or aggravate your pain. You could utilize over-the-counter medications, pain medications such as Tylenol, or anti-inflammatories such as ibuprofen, Advil, Aleve, any of those that you can take according to the instructions on the bottle. Now, if you're on other prescription medications, you want to be sure and check with your pharmacist or your doctor to make sure that those over-the-counter medications don't interfere with your prescription medication. A couple other things you can do at home is use hot packs or cold packs. Hot packs, the heat helps increase the circulation, can help carry away inflammation, help the muscle and soft tissue to relax and alleviate some of that pain that you're having. You want to just keep it at a lower, medium heat and just apply it for 10 to 20 minutes at a time. With cold packs, same thing, just 10 to 20 minutes at a time, maybe every hour or two if needed. Cold packs might be used more with that acute injury or an injury that just happened to, again, really increase the circulation and get rid of inflammation. Can be also helpful with muscle spasms if you're experiencing those. Exercises, both strengthening and stretching exercises are important, and in a little bit we're going to go through some exercises that you could do at home to help with your back. Walking is an excellent exercise. Walking is good for all kinds of things, strengthening your back, your core, your hips, and just general activity. If you cannot walk more than 8 minutes, then don't try to walk more than 8 minutes. A lot of times I tell people, don't think about the distance or feel like you have to walk a mile or two. Know what your body's limits are. Listen to your body. If you can only walk a block, then only walk a block. If you're going out and starting walking, don't walk a long ways away from your home. Walk a short distance and walk back and forth in that short distance to find what you can tolerate. Because if you get a mile from home and you're in a lot of pain, you got to get back. Or hopefully you took your cell phone with you. So we don't want to aggravate the pain further, okay? And if walking is not for you, that's fine. You just have to find some other means of exercise that you can do without aggravation. Physical therapy. Physical therapy is something that can help in back pain. As a physical therapist, we provide individual assessment, so we treat every person individually. We assess and treat as needed, help you identify what's aggravating your pain, what might be causing it. We can help you decrease your pain, increase your mobility, your flexibility, identify improvements we need to make in your body mechanics and your ergonomics, and as well as educate you on what you need to do to prevent future pain. I'd like to talk a little bit more about body mechanics, and I brought along Jason with me today, who's going to help me. So Jason, come on over. We're going to first take a look at Jason's posture. So he's got a nice, tall posture, straight back. One of the things that we do in our daily life that people will tell me irritates their back pain is when they stand to brush their teeth. So Jason, show me how you brush your teeth. Exactly. So look at this bend in his back. He's keeping his low back pretty straight, but this little half bent posture is one that puts the most strain on your back. Okay, Jason, what if you were washing dishes? Okay, go ahead and stand up. What if you were making a bed? Okay, he's in that little half bent posture an awful lot. And again, that places, and his back is hurting him, and that places a lot of strain on your back. So when you do things, you want to use the strength in your legs. So in his case, let's just look at the brushing the teeth again. He'd want to get his feet apart and squat, bend more with his hips and knees, and keep his back nice and straight and head up as much as he could without dripping toothpaste on his shirt. So just remember, you want to keep back straight, not bent, and avoid that little half-bent posture. From there, let's move into your body mechanics when you're bending and lifting. So Jason, I have this box on the floor. Can you pick that up for me? Nah, not good. Look at how much he's bending here, and he is not using the strength in his legs at all. So go ahead and stand up again for me, Jason. So now, Jason, I want you to squat down and squat to pick up that load. Notice how much more he's using these large muscles with good strength in his hips and knees as he lifts it and keeps it a load close to his body. Not a lot in this load, but sometimes when it's heavy, it's very important to keep it close to your body. Let's go ahead and put it back down on the floor. Okay, another way, if squatting is really difficult for you, you can do more of a lunge lift. So I'm going to have you step forward to your left hand and go down in more of a lunge. Again, he's keeping his back straight and using the strength in his legs, in those large muscles of his legs, rather than the small muscles of his back, to lift that load safely. And you can go ahead and put it back down. Thanks, Jason. Let's have you go ahead and lay down here. We're going to go through a couple exercises now that we could do with back pain. The first one I'm going to do, a lot of these you'll notice are stretching exercises. As we go through these exercises, they are not for everyone. So if you do try some of these exercises at home, I want you to pay attention. If it's increasing your pain or causing you pain, you should stop them. When you're taking care of your low back pain, no pain, no gain is not a theme we go with, okay? Every time you aggravate your back, it's like picking a scab, and you start that inflammatory process all over again. So we want to do stretches and strengthening exercises that you're able to do without aggravating your pain. So the first one we're going to do is called a single knee to chest. And we're just going to demonstrate 1 or 2 repetitions of these. You can consult a physical therapist to get more information on how many of these exercises you can do. At Prairie Rehab, we actually offer some 15-minute consults and could talk to you about whether these would be the right exercises for you. The first one I want to do is called single knee to chest. So Jason, I'm going to have you just pull your knee toward your chest and kind of give it a nice hug. That gives a nice stretch through his low back and into the hip. And he's going to hold that for 10 or 15 seconds, maybe even up to 30 seconds if he really needs to stretch, and then let it back down. And he might do 5 to 10 of those. The next one, kind of from the same position, is going to be a hamstring stretch. So your hamstring is the large muscle on the back of your thigh. So Jason, I'm going to have you again hold your leg toward your body, and then he's going to kick his foot toward the ceiling, straightening his knee out as far as he can to stretch this large muscle on the back of his thigh. To get additional stretch, he can do an ankle pump. Okay, he's going to feel that stretch behind his knee and into the calf, and that also helps to kind of get some mobility of that nerve, that sciatic nerve that goes all the way down to his foot. Okay, good stretch?
Yes.
Good stretch. All right, our next exercise is actually a stabilizing and strengthening abdominal pull-in, okay? Our transverse abdominis muscle, which is the length of our abdomen here, is one of your primary core muscles that we want to strengthen. So my instructions to Jason, we're going to just work on strengthening these muscles in the lower abdomen. And Jason, I'm going to have you think about tightening those lower muscles and pulling your belly button toward your spine. So pull it in without holding your breath. Hold for 5 seconds and relax. I really shouldn't see any movement of his pelvis or his back when he's doing this. It's just an isometric contraction of contracting those abdominals, hold for 5 seconds, and then relax. Okay? Building on that core exercise, we're going to do some bridges. So again, we're going to do the abdominal pull-in to stabilize that core, and then I'm going to have him raise his bottom up off the bed, Working those back extensors and glutes and hamstrings. Hold for 5 seconds and then lower back down. Sometimes people have pain in their back when they raise up that far. You do not have to raise all the way up like that. So if I have you tighten and then just raise as far as you can without pain, hold for 5 seconds and back down. Again, it doesn't have to be a large movement. I want you to move pain-free or without aggravating your pain. After the bridging, we're going to go into some trunk rotation. If you've been diagnosed with a herniated disc or a bulged disc, you will not want to do this exercise because we want to avoid any rotation if you have those diagnoses. So with lower trunk rotation, he's going to have that abdominal pull in, and then he's going to allow his knees to go to one side and rest for a couple seconds, and then go to the other side. This is going to be a slow movement, side to side, but allowing for some rotation in his low back and across the hip for a good stretch in that area. Another rotation exercise that takes it a step further is one we're going to do from a figure 4 position. So Jason, I'm going to have you cross your leg, ankle on the knee, and then from this position he's going to rotate that lower spine like he's taking that left foot down to the bed on the opposite side. And again, getting rotation through the lower spine and into the hip. This is a good stretch for the piriformis muscle, which is a muscle that the sciatic nerve often goes through. So this is a good stretch if you are having some sciatic pain. Okay, go ahead and come on back. The next exercises we're going to actually do in a position on all fours, so on your hands and knees. I'll have Jason carefully. He's going to do it up here on the bed so you can see what we're doing. Another thing I recommend for my back pain patients is do not get down on the floor to do your exercises if you do not know if you can get back up, okay? I literally have had someone call me and say, my wife got down on the floor to do her exercises and she cannot get back up. How do I get her up? Because getting up from the floor is not an easy task. So if you have back pain, I really do recommend you do your exercises on your bed. It's a softer surface, but that's okay. So this next exercise from on all fours is called the child's pose stretch. If you're familiar with yoga, this is a yoga pose. You're going to have your knees spread apart a little bit. And then Jason, I just want you to rock back and bring your bottom toward your heels. And then stretch those arms out as far as you can, allowing a full stretch along this spine. Nice stretch. You can hold that for 15 to 30 seconds, whatever feels good. And then he's just going to return to the position on his hands and knees. Okay? In addition to stretching straight back, let's go back again. Bring your bottom toward your heels and stretch all the way back. And then when he gets it all the way into stretched out, he's going to walk his hands to one side and hold, and then walk his hands to the other side. What this does is do a side bend stretch, okay? Gets a little bit of lateral stretch without rotation, okay? All right, come on back up. The last one we're going to do in this position is called a cat-camel. In the cat-camel, we're going to do both some flexion and extension. And firstly, I'm going to have him raise his back up like a camel hump, tipping his head down and just really stretch into that flexed posture. Hold that 10-15 seconds, and then he's going to drop down and really arch, tipping his pelvis forward, bringing his head up so we get some real good extension through his spine. Good stretch. Again, holding 10-15 seconds, and then he's just going to repeat and go back up into the camel. Very good. Hold for 10-15 seconds, and then back down into the extension. Good. And Jason has very good spine range of motion. Good job. Okay, we're going to move to the chair for our last few exercises. In sitting, first we're going to stretch into that bent or flexed posture. So I'm going to have Jason scoot to the front of his chair and have his feet at a nice wide position. And then he's simply going to just reach down between his knees to the floor, getting a nice flexion stretch in his back. Now, some people can reach the floor and get all the way down. Some cannot. And I want you to do just what you're able to do without increasing your pain. Again, this is a stretch, nice stretch you could hold for even as much as 30 seconds or more, as long as you're not having any increased pain in your back. Come on back up. And another stretch in sitting can be a lateral or side bend stretch, where from the same posture, I'm just going to have Jason raise his arm overhead and reach to the other side so we get a nice side bent stretch, lateral stretch through his back muscles, and a lateral movement of that spine. And he's going to, hold whatever's comfortable, anywhere from 10 to 30 seconds, and then do it to the other side as well. Again, as long as it does not increase any of your pain. And the last stretch I want to do is actually in standing. And from a standing position, I'm going to have Jason put his hands on his hips and then just go into an extension movement or bending backwards, okay? So he's just going to bring his shoulders back over his hips. If you have neck pain, you're not going to want to look up. I don't want to irritate that neck pain. Stay looking straight forward and just bring the shoulders back as far as you're comfortable with for a nice stretch, anywhere from 10 to 30 seconds, and then back forward. Most of these exercises, if they're a stretch, you're just going to want to do 4 or 5 of each of those. If they're more of a strengthening or something like the bridging, sometimes I have my patients do 10 to 15 of those. So, thanks, Jason. That's kind of a good overview of exercises that you could do. Again, I recommend if you're having pain or if you've had ongoing pain, it's really good to consult a physician or a physical therapist or a trainer, whatever you're comfortable with. In this day and age, we are able to do telemedicine as well as visits where you come to our clinic, or at times we're able to come to your home. So just check out what's available. Sometimes people wonder, when should I go to the doctor? I can do these things at home, but when should I go to the doctor? When you have severe back pain that's really interfering with your daily routine or your work, or it's interrupting your sleep, you need to go talk to your doctor about it, okay? Because that's really interfering in your life, and without good sleep, you can't heal well. So those are instances when you should go and talk to your doctor. Also, if you have unexplained weight loss or have had unexplained bowel or bladder control changes. The nerves that help control your bowel and bladder are in that lumbar and sacral area. So you need to pay attention to that if that's a change that you've experienced. Also, if you're having numbness and tingling that's radiating into your legs that is not subsiding, it's been ongoing, you should talk to your doctor, or an unexplained weakness in your legs. Lastly, if the pain has lasted more than 2 weeks and you've tried some of this conservative stuff, exercise, over-the-counter medications, hot packs, cold packs, have tried to treat it conservatively, but it's lasted and not getting better, then you should consult your physician. In conclusion, I just want to say, pay attention to your body. If you're having pain, do something about it. You don't need to live with pain. If you have any questions, would like to talk to a therapist and find out, should I go to the doctor? Is therapy right for me? Feel free to give us a call. You can take a look at our website at prairierehab.com. It lists all of our locations throughout Southeast South Dakota and Southwest Minnesota. And you can call any of the locations and they can hook you up with whatever's closest, most convenient for you. And like I said, we can always do telemedicine or a 15-minute consult over the phone with a therapist to get a better idea of what you need to conquer your pain. Thanks for joining me. I hope I gave you some information that might be helpful, and keep looking on Thursday at 1 o'clock. One of our other therapists, Jeff, is going to be talking. Come back on Thursday and we'll see you then. And otherwise, stay safe.